Hello, this is Crystal with Health and Safety.
Hi, my name's Carly. I'm a student worker on campus at North Seattle College. Um, and I was on campus Monday, and then yesterday I started having some flu-like symptoms, a cough and a headache. So I got tested, and today I got my PCR results back and I'm positive for COVID. What should I do?
Well, goodness, I'm sorry you're not feeling well. Since you have COVID, what we want you to do is we need you to isolate and stay home for the duration of your contagious period. What I need to figure out is when did your contagious period first start? So you said your symptoms started yesterday. That's the 23rd?
Yeah.
Okay. And your contagious period would have started 48 hours before that. So your contagious period started on Sunday, the 21st. And you said you were on campus on Monday.
Mm-hmm.
You were on campus. Did you have any potential exposure events with anybody? What that means really would be, were you closer than 6 feet with somebody for a significant amount of time, like 15 minutes or more?
I don't think so. Not while I was at work. I work alone mostly. Oh, but I
Okay.
did go to lunch with one of my coworkers. We were closer than 6 feet, but we weren't on campus.
Well, it would still be a potential to expose them to COVID since you were contagious at that time. I'll tell you what I can do is I can reach out to that individual and I can confidentially notify them that they might have been potentially exposed to someone infected with COVID. I don't have to tell them who it was with or give them the details of that, but they do need to know the information that they might have been exposed so that they can go out and get tested and quarantine if necessary, so that we don't spread COVID throughout our campuses.
Okay.
Could you please give me the name of the individual and I can reach out to them?
Yeah, her name's Betty College.
Okay, I will give Betty College a call and let her know with further direction. So meanwhile, for you, while you're at home, you'll want to stay home and treat your COVID symptoms. You would treat them just like you would the cold or flu. So get plenty of rest, drink plenty of fluids. You can take over-the-counter medications like Tylenol or something like that to ease your aches and pains, and then just follow the direction of your healthcare provider. I do want you to isolate for the full duration of your recovery period, though. So we expect you to be contagious for 10 days after your symptoms first started. That means, again, if those started on the 23rd, then you would expect to be contagious until December 3rd.
December 3rd.
That would be 10 days from yesterday when your symptoms first started. So
Oh,
if by that time, as long as your symptoms have improved, and if by that time, as long as you've been at least 24 hours without a fever and that you haven't had to use any kind of fever reducing medications like Tylenol or acetaminophen, then by then you could return to campus and you would be cleared to safely return.
I think I have a big test the week before that. I'm a student as well. I don't know if I can take off 10 days of class.
Well, your instructor should have a plan ahead of time, and they know that they might come to a time that they'd have a student that has to isolate for a duration of 10 days, or maybe a student that goes into quarantine for up to 14-day period. So they should have a plan and know how they can accommodate you for this and know that they need to do that during this pandemic time. If you'd like, I can notify your instructor, let them know that you've been specifically instructed not to come to campus until the 3rd and that they need to accommodate you for this. Would you like for me to do that?
Yes, please.
Okay, you mentioned that you're a student worker. Would you like me to notify your supervisor of the same?
Yes, please.
Okay, I can do that for you then. I will email them. I will also include your email. I'll CC you there. So that will give you the support. It'll give you my contact information. And if you need any additional support, you can follow up with that email. Do you have any questions for me?
No, I think that's it. Thank you so
Okay.
much for all your help.
All right, well, I hope you feel better soon and best of luck with everything, okay?
Mhm. Bye.
All right, bye-bye.